Your brain has 86 billion neurons controlling everything you are, your memories, personality, movement, and identity. Medicine has identified over 600 diseases that can destroy it. Some begin silently, decades before symptoms appear. Some kill within 24 hours. This is every major brain disease explained. Section 1. Neurodegenerative diseases. Neurodegenerative diseases progressively destroy brain cells with no way to stop them. Alzheimer's disease affects 55 million people globally. The primary cause is the abnormal buildup of amyloid plaques and tau tangles between neurons, triggered by a combination of aging, genetics, and lifestyle factors, including chronic inflammation and poor sleep. These proteins strangle neuronal communications slowly. First, you forget small things, then names, then faces, then family members, then how to swallow, then how to breathe. Damage begins 20 years before the first symptom appears. Parkinson's disease destroys dopamine-producing neurons in the substantia nigra, caused by a combination of genetic mutations, environmental toxin exposure, including pesticides, and mitochondrial dysfunction within neurons themselves. Movement becomes trembling, slow, and rigid. The face freezes into an expressionless mask. Loss of smell, years before tremors begin, is now recognized as the earliest warning sign. ALS is the cruelest neurological disease known. It is caused by both genetic mutations, including the SOD1 and C9orf72 gene variants, and unknown environmental triggers that cause motor neurons to systematically self-destruct. Arms, legs, speech, swallowing, breathing shut down progressively, while the mind remains completely intact throughout. Fully conscious, fully aware, trapped inside a body shutting down piece by piece. Average survival is 2 to 5 years. Huntington's disease is a genetic time bomb caused entirely by a single inherited mutation in the HTT gene, a CAG repeat sequence that expands beyond normal length, producing a toxic protein that accumulates in and destroys brain neurons. It guarantees the disease develops between ages 30 and 50. It begins with personality changes mistaken for psychiatric problems, then involuntary movements, then complete neurological collapse. Every child of a Huntington's parent has a 50% chance of inheriting it. Multiple sclerosis occurs when the immune system mistakenly attacks myelin, the protective sheath around nerve fibers, triggered by a combination of genetic susceptibility, vitamin D deficiency, prior viral infections, particularly Epstein-Barr virus, and smoking. Signals short-circuit unpredictably, causing sudden vision loss, partial paralysis, electric shock sensations, and crushing fatigue, symptoms that can appear and vanish randomly, making MS one of the most unpredictable diseases to live with. Section 2. Psychiatric brain disorders. These are not character flaws or weaknesses. They are measurable structural and chemical diseases of the brain. Schizophrenia causes the brain to lose its ability to distinguish reality from hallucination. It is caused by dysregulated dopamine and glutamate pathways, triggered by genetic vulnerability, combined with prenatal complications, childhood trauma, and cannabis use during adolescence when the brain is still developing. It affects 1 in 300 people worldwide, producing vivid voices, paranoid delusions, and fractured thinking that feel completely real to the patient. Bipolar disorder produces extreme chemical voltage swings between mania and severe depression, caused by dysregulation of serotonin, dopamine, and norepinephrine systems, with strong genetic heritability and stress-related triggering of first episodes. During manic episodes, the brain operates in dangerous overconfidence with reduced need for sleep. During depressive episodes, the same brain becomes completely immobilized. Severe OCD is a neurological loop disorder where the orbitofrontal cortex sends repetitive error signals the basal ganglia cannot shut off, caused by serotonin system dysfunction combined with genetic factors and sometimes triggered by streptococcal infections in children through a mechanism called PANDAS. The patient knows their thoughts are irrational, but neurologically cannot stop them. Borderline personality disorder involves severe amygdala hyperreactivity and reduced prefrontal cortex regulation, strongly linked to childhood trauma, emotional neglect, and genetic predisposition affecting the brain's ability to regulate emotional responses proportionally. The result is explosive emotional responses, unstable relationships, and a fragmented sense of identity. Dissociative identity disorder occurs when severe, repeated childhood trauma causes the brain to create entirely separate identity states as a survival mechanism. Brain imaging confirming measurably different neural patterns, eye movement, and physiological responses between different identity states in the same person. Section 3. Brain tumors. Glioblastoma is the most aggressive primary brain tumor caused by genetic mutations in glial cells, including EGFR amplification and PTEN deletion that trigger uncontrolled cell division. It invades surrounding tissue with tendrils, making complete removal impossible, and kills within an average of 15 months, despite surgery, radiation, and chemotherapy combined. Meningiomas develop from abnormal meningeal cell growth, most commonly linked to radiation exposure, hormonal factors explaining why they occur twice as often in women, and NF2 gene mutations. They grow so slowly they can reach tennis ball size before symptoms appear, then suddenly cause seizures, personality changes, and vision loss as pressure builds. Pituitary tumors arise from mutations in pituitary gland cells, often involving the MEN1 gene, and despite frequently being benign, they sit at the brain's hormonal control center, simultaneously derailing growth hormone, cortisol, thyroid, and reproductive hormones, causing whole-body hormonal chaos. Brain metastases occur when primary cancers from lungs, breast, kidneys, and melanoma breach the blood-brain barrier through circulating tumor cells and are actually more common than primary brain tumors, dramatically worsening prognosis of any original cancer. Section 4. Vascular brain diseases. Your brain uses 20% of your entire blood supply. Interrupt it, and 1.9 million neurons die every minute. Ischemic stroke, 87% of all strokes, is caused by blood clots forming from atrial fibrillation, carotid artery disease, or atherosclerosis blocking brain arteries. Face drooping, arm weakness, speech difficulty, call emergency services immediately. Every second lost is brain permanently destroyed. Hemorrhagic stroke occurs when chronically high blood pressure, arteriovenous malformations, or blood-thinning medications weaken vessel walls until they rupture, flooding brain tissue with blood, while catastrophic pressure builds inside the rigid skull. Brain aneurysms form when chronic high blood pressure, smoking, and genetic connective tissue disorders weaken arterial walls, causing them to balloon silently for decades undetected. Rupture produces the worst headache of a person's life, instantaneous and thunderclap. 40% of patients die within days. Vascular dementia accumulates through silent mini-strokes caused by the same risk factors as major stroke: hypertension, diabetes, high cholesterol, and atrial fibrillation, each individual event unnoticeable but collectively creating a staircase pattern of sudden cognitive drops. Cadasal is caused by mutations in the Notch3 gene that damage small blood vessel walls throughout the brain, causing strokes and dementia in adults aged 30 to 50 with no conventional cardiovascular risk factors, beginning with migraines, then progressing to full dementia. Section 5. Infectious brain diseases. Bacterial meningitis infects the brain's protective membranes and can kill within 24 hours. The non-blanching rash is the critical warning sign. Survivors frequently lose hearing, limbs, or suffer permanent brain damage. Viral encephalitis directly inflames brain tissue. Herpes simplex encephalitis can permanently destroy memory and personality within days without immediate antiviral treatment. Rabies travels nerve pathways directly to the brain, then causes aggression, hydrophobia, and hallucinations before inducing fatal coma. Once neurological symptoms appear, survival is virtually impossible. Prion disease, CJD, is the most terrifying brain infection. Misfolded prion proteins convert healthy proteins in an unstoppable chain reaction. The brain develops holes like Swiss cheese. Rapid dementia within weeks. No treatment, no cure, no way to slow it. Prions cannot be destroyed by cooking, radiation, or sterilization. Cerebral malaria allows the malaria parasite to cross the blood-brain barrier, causing seizures, coma, and catastrophic brain swelling. Section 6. Seizure disorders. Epilepsy affects 50 million people worldwide, uncontrolled electrical storms firing through brain networks, producing convulsions, loss of consciousness, and post-seizure confusion. Absence seizures are deceptively invisible. The person stops mid-sentence, stares blankly for 5 to 30 seconds, then continues normally with zero awareness the seizure occurred. Children go undiagnosed for years. Status epilepticus is a continuous seizure exceeding 5 minutes, a neurological emergency where prolonged electrical activity rapidly destroys brain cells through oxygen deprivation. PNES, psychogenic non-epileptic seizures, look identical to epileptic seizures externally, but have zero electrical brain activity. They are entirely psychological in origin and require completely different treatment than epilepsy. Section 7. Traumatic brain conditions. Traumatic brain injury can permanently alter personality, impulse control, and memory, sometimes transforming someone's character overnight while appearing invisible on basic scans. CTE accumulates silently from repeated head impacts, building tau protein that destroys brain tissue, causing aggression, depression, and dementia. Found in 99% of donated NFL player brains studied, only diagnosable after death. Cerebral edema swells the brain inside the rigid skull, compressing tissue and cutting off blood supply until the brain herniates downward through the skull's base opening. Diffuse axonal injury physically shears millions of axon connections between brain regions apart from rapid acceleration-deceleration forces, appearing normal on standard CT scans, while catastrophic damage exists internally. Section 8. Developmental brain disorders. Autism spectrum disorder involves atypical brain wiring from birth, affecting social processing and sensory integration in highly variable ways across individuals. ADHD involves measurable dopamine regulation differences and prefrontal cortex development variations, confirmed by brain imaging as a neurological condition, not a behavioral choice. Cerebral palsy results from brain damage during development, before, during, or shortly after birth, permanently affecting movement and motor control. Hydrocephalus occurs when cerebral spinal fluid accumulates inside brain ventricles, crushing surrounding tissue from within. Without surgical drainage, it causes permanent damage and death. Microcephaly develops when the brain fails to grow normally during fetal development, resulting in significantly reduced cognitive function depending on severity. Section 9. Rare and terrifying conditions. Fatal familial insomnia makes sleep neurologically impossible, progressing to hallucinations, rapid dementia, and death within 18 months. Fewer than 30 families worldwide carry this gene. Anti-NMDA receptor encephalitis causes the immune system to attack brain receptors, producing sudden, violent psychosis in completely healthy young people, many times misdiagnosed as psychiatric illness. Alien hand syndrome causes one hand to act completely independently against conscious will, the two brain hemispheres losing communication and operating as competing separate brains. Capgras delusion disconnects facial recognition from emotional response. The patient recognizes loved ones perfectly but feels no emotional connection, concluding they must be identical imposters. Exploding head syndrome causes the brain to generate a thunderously loud explosion sound during sleep transition with no external source, mechanism still poorly understood by neuroscience. Section 10. Disorders of consciousness. Brain death is complete permanent cessation of all brain activity, including brainstem. Unlike coma, it is entirely irreversible. Vegetative state keeps the brainstem alive, maintaining breathing, while higher consciousness is completely absent. Eyes open, reflexive movements occur, but no awareness exists behind them. Minimally conscious state contains flickers of genuine awareness, trapped with almost no way to communicate. Brain imaging has revealed patients classified as vegetative were actually fully conscious and experiencing everything with no mechanism to signal it. Coma suspends consciousness while brainstem functions maintain survival. Science still cannot fully explain where consciousness goes or what separates those who return from those who don't. The brain can lose pieces of itself decades before you feel a single symptom. Early awareness is the only advantage medicine can give you. Share this with someone who needs to see it.